because you've been with us for a while, and I know you started your preparation
I passed already.
early. I know you did, but you
I,
started early while
I
you were in
went to
school.
Walden. I started while
Walden,
I was in
okay.
school, and I graduated. And in 2 weeks of graduation, I passed my boards.
Yes, that's fantastic. That's why I was asking because I know you started early,
Yeah, I started
before
while
you
I was in
graduated,
school.
but I didn't know where you went to school to. So
I went
this
to
is actually
Walden.
important. Yeah, not taking anything from Warden or any other schools, right? Doesn't matter where you went to school. In a sense, it does matter. Okay, let's not say that doesn't. It does matter a lot. However, no program will teach you to pass the board. What they'll do is they'll give you all the things you need to know specifically about the personality disorder, but they will not cue you in what the board finds it necessary. They will not, right? What they'll do is that they'll pick up 50 things about borderline personality disorder and say, this is borderline personality disorder. Know it, right? While other school might pick up 10. But no school is going to be like hyper focused on passing the board because it is a measure of how well the education is giving, but at the same time, they are not teaching to pass the board. They're teaching for practice, right? And teaching for practice is very different than passing the board. So my point is, whether you went to Harvard or my school or Weldon or any other school, they are concerned about how you will practice after and not necessarily how effective the program is to pass the board. So and it's a critical difference, right? A lot of people think, well, I went to X, Y, and Z in school and I didn't learn to pass the board or anything else. Anything else is different, but passing the board programs don't teach you that. Okay. They're
Dr.
not
Lopez,
going to go, yes, go ahead.
I just want to read my review to this group. Uh,
Okay. Thank you.
as I say, thank you, Dr. Lopez, for simplifying the study material I needed to complete my studies in school and pass my ANCC boards within 2 weeks of graduation. I followed your instructions, watched every module, observed the great breakdown of all the content with the easy to digest bite-sized videos, and made notes as I grasped the content of the amazing videos. The effort I put into attending the Kahoot sessions on Saturdays or watching the recordings of the sessions I missed made it possible for me for the to make up the time for myself that I took for the test. Furthermore, the crash course was an excellent way to reiterate the learning before I attempted the question banks, especially diagnostic tests too, which made me confident enough to test. I answered 150 questions in 2 hours and 18 minutes, scrutinizing every question as I tackled it, hearing your voice in my head saying, no, 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 as I saw the crucial aspects stressed to make them presence on the boards. I achieved my goal of passing my boards as a lovely Christmas present. Thank you to you, Dr. Lopez, and your team. You are gems to
Thank
the
you.
PMHNP community. I enjoy Christmas and the holiday season with my family and now
Yes.
start my job hunting. Of course,
Woohoo.
you with my
Yes.
psychopharmacology course to gain confidence in prescribing.
Yes.
Thank you so
Well,
much.
it does brings me chills, a goosebump. Because you really embrace it, right? So it is super cool. So I really thank those students that took the time to actually write a review, and I don't take that lightly. I know my job is to ensure that you're ready, and if you don't pass, it hurts me. If that becomes the thing, I'll lose sleep maybe more than some people, right? And I'm thinking what went wrong, what could cause that outcome. But last year alone, we helped over 740 students pass the board, and that's not a small feat, right? Because everyone is different. Some people going through divorces, financial issues, and etc. And I don't want to be taken advantage of, right? Some people say, "Hey, I'm in disability." I'm like, "Okay, so show me some proof, and I'll give it to you for free." Okay, but I don't want to, like as in I might have I never hear back from the person, right? So basically, what I'm saying is like if you know someone that truly is going through a hard time, and whether it's finance, whether it's divorce, whether it's a broken family, and they can't afford the course, if it's truly and it comes from one of you guys that are in a course, I make no objections for the person to get it for nothing or near nothing. uh Leaving a review, it's important, right? Because I don't always ask, and I've been asking for uh this week, but the most important thing is you and you achieve your goals. And we're trying to not only help you now, but help you in the future. We're building another class in it's going to be free to you, but it's going to be a charge for the others, right? Obviously, for obvious reasons, but it's all free to you guys. Anything that I make it going forward, like it's for you. You are the reasons. You, Seashell, and everybody else that is in the course that will try to make this community stronger. So we're building a. Right now, we're in the process of recording. It takes a long time to record diagnosis, right? So I'll present a case and I ask you, what's the diagnosis? What the medication you'll be using? And guess what? It's going to be all free, right? So when you take the time to leave a review, it helps us to stand out, because I did a poor job of standing out, right? I did a lot of good job of interactions, but not always. People that don't take the time to leave a review, they may never know about us. They always go with, uh, in my eyes, not the best choice. And half of our students come from another course because they didn't pass. And that's okay. There is no hard feelings. Maybe it was my negligence for not standing out online, right? I was more focused on you guys and really trying to dedicate a lot of time, and I didn't take the time to stand out online. So now I started this week. I'm like, I need to put my reviews out there, and a lot of good people are saying good things. And what I mentioned early in this class is that this week I'm going to take 2 weeks. I'm going to put a full 80 hours off from work, and I'm going to do a worksheet for you guys. This worksheet will do most of what she shall just mentioned. I'm going to break it down each of the classes, over 100 videos, and I'm going to ask you questions, specific, pinpoint, for you to answer, right? I may make another video answering the questions, but the point is that you need to do it because it's the act of recall rather than a passively given to you that makes a difference, right? So what you did, you active recall, took notes, revise, active recall, took notes, and revise. And that is the recipe for success any day of the week. Okay, so thank you so much for leaving us a review. I kindly appreciate that a lot. Okay,
Dr.
so
Lopez, I literally could hear you in the exam saying, no, 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 whenever you
hey, whatever is the point that drives the right results, that's what we're looking for. We're looking for results, and for you guys to really pass and do well. And guess what? Passing the board is great and is excellent, and that is the reason why we're here specifically. But after, right? So not, I have no credit in this, but like I helped two nurse practitioners, or I'm not going to specifically say it, get a bonus of huge bonus, like 250,000 extra on the job. I'll talk to you guys more about it later, right? So that's what we do. Not only help you pass the board, but I'll be on the lookout. If I see a good job, I post it immediately. Hey guys, this is actually a phenomenal job opportunity, and help you succeed. And if you get a job, right now we're working on your other things that we work on your profile, building your reputation. So I'm going to open a blog and allow you to write anything about anything you want to write about. So what we're trying to achieve with that is you standing out. Let's say somebody looked up your name, Seashell, and be like, oh, she has written 5 reviews about, not reviews, a blog about depression. That might have an impact on your career. May not. It may help others educate about major depressive disorder, or what choices of medications you would give. It helps you to take out of your head and put it in a piece of paper and put it to the world to see it. So I'm working on the blog right now. We have a blog at our www.mp exam coach. I'm gonna send an invite and say, hey, what would you like to write about? And then I'll create your Google profile. When somebody search you, your name shows up. You know, some employers might be looking at you and be like, oh, this person is actually, writing content about mental health. That person may stand out compared to others that don't, right? So we're creating that project. We're creating the diagnosis classes for those that are already passed the board. That's over, and then we'll transfer your account to another one. And it's going to be free for you guys that are part of the group, right? Obviously, yeah, I have employees that have to pay bills to weekly. So, but thank you for writing a review. It really helps. It helps us a lot. So I appreciate that. And your candid review, it's more important than any other option. And if we didn't do well, I would like to know how to improve as well, right? So thank you for that. Appreciate that. Ebony, do you have a question? You also wrote us a review. Thank you.
Oh, yes, absolutely. I appreciate it. It looks like your eye is doing much better. So I give
Yeah.
you healing,
Yeah.
healing mercies and hope that it gets back to 100%.
I
So,
appreciate that for sure. Yeah, it's getting better and better and better. I still have 70% of my vision is lost. I think if I look it down, I can see it. So what it means is there is gas in my eyes to close the retina, and then maybe once these gas are gone, and I have to be 12 hours looking down in the prone position every day. So I just take the break to do the class and go back to bed and looking down all days. It's torture
okay.
to me. But once
Okay.
the gas is over, I'm hopeful that my vision will come back and life will be just as great as it is every single day. So,
Good.
oh,
Okay. So my
yeah,
question, I just wanted to know, what's the best way to remember the neurotransmitters as far
yes.
as
So,
each step, because there's so many that goes with each.
right, right.
So what's the
So,
best way?
yeah. So, yesterday we cover the module three, right? So, module three was a lot of neurotransmitter. And one of the tip of advice that I gave was to, in one piece of paper that is completely blank, those neurotransmitters that we covered yesterday, write the buckets. So the buckets of DNS. So it would major depressive disorder, ADHD, and Tourette's. And then you're going to put a bucket um, for schizophrenia, right? So you're going to put excessive dopamine, excessive glutamate, low GABA, and low serotonin. And then you proceed with that for every other condition that we covered on module three. So I would, if you don't have to watch module three again, but just get the PDF and write them down. Why I don't give it to you guys is because it's more important that you write it down yourself and keep it in a separate piece of paper than me writing down. So I'm trying to give you as much as you need to pass, but not enough that becomes it works against you, right? Passive learning is a lot less effective than active recalling. So I would say I'm going to create a sheet for module three. I'm going to start with module three, four, five, and then go module ones and two that will ask you for this condition what neurotransmitters are most likely involved. So at least I give you the shell for you to fill in and to be able to get those answers. Hope that helps a little.
Okay. And then I just had one other question. How long is
Sure.
the pharmacology course? Is it a 30
1
day?
year. Nope.
Oh, it's
1
1 year.
year.
Okay.
1 year. Yeah. So we'll give you time to drink some wine, get some cheese, and enjoy the course because it's going to be long. The course is nothing less than a 4 months of learning. Why do you really need that, right? It's only for those that are either in school, going through a psychopharmacology course, or going or already passed the board. You don't need that for the board, right? Because no one, if they were to ask all the neurotransmitters involved on each medication or receptors, not neurotransmitters, uh, then it would make it basically impossible for anyone to pass. So it's not necessary for the board, but it's excellent resource. So you don't get sued. It's an excellent resource. So you treat your patients and have a high retention rate, right? If you are able to treat your patients and their condition improves, they'll be your customers for whatever. until you say no, we have to stop with this. I can't take it. No more patients, right? Because you really fix the problem. If you are able to fix any problem, you have a customer, right? So yeah. So I think it's a 1 year is, there is a community forum, but it's basically online at your pace. And if you have questions, obviously we'll be able to answer that. Okay,
Okay, thank you.
absolutely. Anybody else? Rob,
The
do you
what?
have Rebecca? Do you have a question?
Yes, it's on today's Kahoot. I think you said we'd go over it later. It's the question where the patient is already diagnosed with borderline personality. She's having severe mood swings, impulsivity, and
Yes.
recurrent episodes of depression, and you don't start a mood stabilizer.
Okay, so you answered the question. So thank you. The reason why I didn't remember specific the question, but when it said major depressive disorder, right?
It did not, no.
But you mentioned that severe depression.
Borderline personality symptoms with severe mood swings, impulsivity, and recurrent episodes of depression, listed third
Okay,
after severe
so
mood.
right. So if it's severe depression, then the most likely medication would be an SSRI. If it didn't have severe depression,
It's not
right?
severe,
It,
it's recurrent. It says
okay,
recurrent,
recurrent.
severe mood
Okay,
swings.
sure, severe mood swing, but that could be due to co-occurring major depressive disorder. So think of this way: the most likely you would not want to start a mood stabilizer on this patient first. Start with what's the basics is the depression. I'm not saying it's the most prominent. I'm saying it's the basic. Take that away and then treat the others. One thing at a time. When I am treating, um, let's say ADHD and anxiety, I don't start with a ADHD stimulant first. Even though the patient came in for ADHD, I'm going to start with the anxiety or depression that's occurring. I take that away and I see what's left. So although different case scenario, it still applies. Start with the basics. In this case, said recurring depression. So it could be that she has a mood swings due to atypical depression of some sort. But if you take that away, see what's left, and then you treat what's left. So for that case, more specifically, I didn't remember when it said the recurrent depression, but that makes a stronger case for an SSRI. Okay. Now, one of the modules, I think I said, hey, if it says like destruction of the property or severe impulsivity leading to recurrent suicidality or suicidal attempt, maybe we could start looking at the mood stabilizer specifically, lithium and Depakote. Okay. I think, forgive me for saying that, but I think you are very concrete.
Right,
Try
and
to
I'm
pull
trying
it.
to
Yeah.
break
Yeah.
that,
So
but the word severe just took
stuck
the
at you and you were like,
answer.
okay.
That was it.
Okay. Yeah. But I think in this specific case, because of a recurrent depression, even with everything else, I would definitely start with an SSRI first and then
Okay,
actually see. Because oftentimes patients, what they say is not necessarily what they meant, right?
okay.
We have to look at that and be like, okay, have to use a little bit more clinical judgment and a little bit of time. The best thing in psychiatry is wait, wait, and wait. Change the medication or increase the dose. Wait, wait, and wait. Increase another dose. I shy away from heroic measurements. What I mean by that is like I see some providers that will go on and above to do for the patients and sometimes end up hurting them rather than helping them. When they say that, they go above the limits on the medication. I'm like, I'm not going to put my license and I'm not going to put the patient at risk. I'm
Yeah.
going to do what is the guideline, and if that doesn't work, oftentimes it does. I
Well,
I think in
I
my
want,
own practice, like the success rate is so high that I even like I don't know why if it's the same thing for everyone else. I really don't. But the success rate that I get with depression and anxiety is like in the 95%. I can count on my fingers patients that came, got the full treatment as prescribed, and did not recover. And I'm not entirely sure. According to the literature, it's not that high. But I think it's because I wait. I try to explain this is not a magic. This is going to take a while. I put the standard with the expectation very low, and then boom, it kind of like, whoa, this is really work, right? Rather than say, here's your pill next week. How many times I get people from other providers and they took the medication 3 weeks and they said they didn't work and move on to another medication? I'm like, you had 5 medications, but in reality, you had zero because you didn't give enough time or the dose wasn't high enough, right? So
well,
I'm going to
I
start
went
from
to
zero.
an earlier question in the Kahoot about ADHD, and we went straight to stimulants. Never had tried a med before, but we didn't start with SSRI. But I get that. That's what you do. That's the first line.
Hmm.
But in
Yep.
this one, that's what I waited against. And I said, okay, straight to the big guns and got it
Oh
right.
yeah, no, yeah. So ADHD is different, right? We talked about
Yeah.
the
Yeah.
reason behind yesterday, and I give a story of how I was taught by one of the best peds uh, psychiatrists in my mind. And he said, "Hey, the reason why my sister wound up being in the streets is because she wasn't treated for ADHD, while I wasn't either." But I can see why I turned out one way and she didn't. Maybe I muscled through it, right? And while she just didn't have this encouragement. So
Yeah.
not everyone, even though we may give the same conditions to everyone else, some people might just be above and beyond what others would do. But the reason with ADHD is that how would the child feel? Hey, John, you are no good. Hey, John, you're always late. Hey, John, why you never turn in your homework on time? Hey, John, why you always get C? John will never think highly of him, right? So the self-esteem, it is what really my in my concept, in my ideas, like bringing the self-esteem, bringing the best of the person to life is what could easily turn someone's life. One decision, it could make the person go to be the best version of themselves versus leaving the street, right? uh,
Yep. You work to build their Maslow's tower rather than tear it down.
yeah, absolutely, absolutely. Well, thank
Well,
you for your question. I think it's very important though.
I get the differences. With ADHD, you have a first line choice. With this one, you had 3 different diagnoses, and I needed to pause a moment and weigh them out and start with that more minorly described one, but it can overlap on the others. I can see that.
Beautiful.
I had
Yeah.
2 more
So
quick questions. Is it true
yes.
when we take the boards that you can like digitally line out your rejected answers? To me, that's like pure gold if I can put a visible line on the screen.
Okay. So can you tell me a little bit more about that? Can you rephrase the question?
Like you've read the question, you A is wrong. It cannot possibly be A. You don't want to reconsider it. Can you
Yeah.
strike through that digitally? Oh, that is amazing.
I don't know if you can choose the answer choice. I know you can through the question for sure. You can also highlight the question, right?
Okay.
I'm not sure if you can for the answer, which I think is a software. I'm pretty sure you can because if you can highlight the question, why wouldn't you be able to highlight the answer? But I just don't remember if that's the case. I know because I highlighted everything, you know. And then what I would do is, let's say you encounter a question that you're not entirely sure. No matter what the question is, at that moment you're gonna pick 2 answers that are not correct, and then you're gonna let answer A and D, and you're gonna put the number 150, and then that way you save it for review later. At the end, before you submit it, it's gonna say, "Hey, you have 5 questions to review. Would you like to review them at that time? And then it's going to show up. Now, at that time, you're going to look at your piece of paper and say, okay, I put it out B and C is not the right answer. So I am only going to consider A and D at this time. Okay, so that's a walk around if it doesn't allow you to strike through, which I'm confident that probably would, unless if they
Seems
did
to
a little code
Did it let
strike
you
through,
mark?
right?
Yeah.
Yeah, so it lets you highlight it, it'll strike through all that. The question, I don't remember the answer, but I'm pretty sure that it does.
Okay, and
Could
last
be
thing,
wrong.
I
Sure.
just wanted to suggest, because you spend all day face down looking at nothing, it might really be comfortable and therapeutic if you had a blinding patch over that eye when you're trying to look at the
I
screen, read the
know.
right. It
So
might really be comfortable and therapeutic.
yeah, no, I do have one, but it's a plastic, is a yellow. It's for protection. Maybe I need something that's soft for sure. It might be
Even a
helpful for
gauze,
sure.
from Walgreens, a gauze pad be soft and comfy and just take that eye out of the game.
Yes,
Just
I will
okay.
definitely take that because I can wear my glasses with that. That's for sure.
Yeah. Thank you for everything.
Thank you. Sure thing. Kim, do you have a question there?
Hi, Dr. Lopez. First and foremost,
Hello
thank you
there.
so much for everything that you do. You're incredibly patient and you're so generous with your time and your resources. I
Thank you.
genuinely appreciate it. I'm sure we all do. I have a quick question actually in
Sure.
regards to Seashell, if she's still here. She had mentioned,
Yeah.
I thought, if I heard her correctly, that she answered 150 questions and it's generally always been 175. Did they change the test standard?
Great
Or
question.
I don't know. Actually, when I was answering my exams, the computer just stopped at 150. And I turned around and I looked for help, thinking, my God, it is 175. Why did it stop at 150? But then at the top part of the screen, it showed that it was 100% complete. And the
oh,
computer kept
Which one?
Oh, wow.
Shishel, which one did you take? You take ANP or
ANCC.
ANCC? Oh,
And
because
I
it
wonder-
usually has
it was
150.
it was only 2 hours and 18 minutes. And
yeah.
I was worried that, oh my God, it's a 4 hours exam. It's 2 hours, 18 minutes. But then, when I was answering the questions, I actually scrutinized each question that I did not want to go back and check my answers because
Right.
so I just thought, okay, it's 100%. Okay, let's go out. I went out of the thing. In 5 minutes, I got the email that I passed.
Congratulations. That's fantastic.
Yeah.
The question that I have, Seashell, or the comment I should say, is
Okay.
that those extra 25 questions, I wonder if they're being somewhat competitive with the AANP exam, which is only 150 questions. Because now
Yes.
they're in competition. So if they
Yes.
bring yours down to the 150 and eliminate those extra 25 questions, of course, that's going to be better for us taking the test. And she's not the first person that mentioned that. I heard somebody else say mine was only 150. And I thought the same thing. You know how like the NCLEX cuts off at
Mhm.
75 questions? I was like, well, maybe they
Yeah.
did so well cut off, but this is not the first time I'm hearing it. So I'm wondering if they're tailoring it to eliminate those extra 25 questions, which would be very good news. I think that's fantastic.
Yes.
It showed
Yes,
that I
absolutely.
answered all the questions and it was 100% complete.
Yeah.
So
Well,
that
you know
is the
what?
only
I'm very
thing.
happy to hear. I would love to do 150 instead of 175, but
Yeah.
It is
congratulations.
cruel. Yes.
So I just
Cito,
thought
on your
100% complete,
success.
I will go. And no one was coming to me for help. Like, I wanted to ask what happened. Why did it stop? But then I saw the screen. There was a green line which said 100% complete.
Well, obviously, yes, fantastic. I hope that that's true moving forward, that they've changed it to 150. I might give a call to ANCC and ask,
Yeah.
have they changed the standard? Because if they're concerned about having so much competition about the AANP, which is only 150,
Mhm.
they might
Yeah.
have kind of rebooted their test process, which would be beneficial for all of us. So
I
I think
understand
congratulations again. Great
of
job.
Silver though.
I feel like
It's
this
an-
has been a topic on a couple different pages that I follow.
Yeah.
And I vaguely remember somebody posting that they did call on it, and
Okay.
it was like a program error of some sort, that it wasn't
Um,
giving those 25. And it was, I think they have fixed whatever it was that was causing that issue. I'm not 100%, but I do remember this being a topic a couple weeks ago. Pretty heavily, and
Perfect.
somebody had posted they had called on it.
Oh, okay.
Oh.
Thank you. Well, I
Yeah.
hope it's
So in that
not
case,
fixed.
we
They're
can.
still working on it.
Yeah, that's great, Kimberly. Great question, because I heard that too. It's just, so many people say, "Oh, this institution is not good for Texas," and then that being it is. So I always say, go get the information from the source.
It-
But I
Right,
appreciate that,
right.
and I think
I
if they
just, my ears
did,
perked up when I heard her say 150. I said, did she say 150? Maybe it's
Yeah.
true.
It's an
All right.
algorithm.
yeah,
If you're
Before
doing
150.
really, really well, it's an algorithm. It kicks you out. NCLEX does the same thing. I about had a heart attack in NCLEX because it cut off so soon. And of course, that's been a long, long, long time ago, but this one does the same thing. It's an algorithm. If you're doing a very high score, because they don't tell you you score if you pass. If you're just getting them all, they just cut you off. You're done.
Hmm.
I don't think
I don't
that's
believe
true.
that. I don't
of
believe the
that's
ANCC
not
test
true
is
of
an
the,
algorithm one.
yeah, they don't have an algorithm. The NCLEX does, but not this test. So is that the differentiation of those 25 questions that are considered, they're not graded, they're more like test questions that they might use in the future. So yes, Samantha, I think that was your name, Samantha. I have heard that too, that it was some type of a program glitch, and I've also heard that they're competing with AANP, and so they're reducing to the 150. So you know what? The proof will
That
be in
would
the
be
pudding when
great.
I go take the test. I would be very happy. That's 25 less questions to answer. So
Dr.
Thank you.
Yeah.
Lopez, Caroline here.
Yes. Hi.
So I'm doing an exam twice. Somebody recommended you to your review.
Okay.
So I will
Thanks for
tell you
coming to
this.
us, though.
Yes, I'll tell you this. The reviewer that I went to, some of the colleagues that did the exam, they have been getting the second test takers, I think, are those who are getting kind of like 150 questions. The first test takers have been taking 175. It's kind of like something that is I think they are competing with, because I got to do a review over a day after doing the exam, because they asked me the reason, like, they going back and they are like asking you for like to give them a review, and I told them really why, like, like, why are the exams so very hard, first of all, and it's like so like too much you're working with, and the questions are so many. And I think, like, kind of like, I was like, it's too much, and the ANP, it gives 150. So I think people are giving them feedback, and they're kind of throwing it out. Like, I think they're giving
Yeah.
150 and 175. So whichever test you take,
Yes.
I don't know. I think there's some people who are getting 150 and other people are getting 175.
Yeah.
That's
So, thank you for sharing, and I can assure you that thanks for actually saying that you are right. I can assure you that like 50% of our students, they came from another course because they didn't pass, right? And I'm not gonna mention name. That's not for me to do that. But I can almost say where the most of the people came from, because they will say the name of the person in the group, and they're like, I want to throw stones at that person, right? But here's the thing, right? I'd say if you didn't pass the first time, it's totally okay. It's not the end of the world. Now we have to be careful the second time. We have to be careful, really, really careful, because now it's like when you have a seizure, your brains will remember of that kindling, right? We talked about that. Now you've been somewhat traumatized. It's so much harder to work with those that have not passed the first time, working with them the second time, than it is to get a brand new student. Because a brand new student is just going there, okay, I got this, got it, right? And they pass. But now, if you have been traumatized, even though you may say I have or I haven't, your brain kind of remembers. So going through the test center, it is different now, right? You become a little bit more nervous. So how we are going to overcome that is by really being able to talk about the content like it is our last name. Really know it. So don't, even though it may take a little bit longer, a little bit more hard work, it's very possible to pass the second time. But we just gotta do it very carefully. Now we gotta really do the walk, do the talk, do the homework, and not rush the process. Take it the take the journey as a loving journey rather than I need to achieve this result. The results will come. And I say this because I don't want people to zoom through the content and go test it out. Because you might know the content and a lot
Dr.
yeah,
Lopez,
well, because you were
your,
anxious,
oh, sorry.
right? Because you were anxious. So just be very careful on the second time. If anyone the second time test takers, uh, to be careful. Okay, but it's very possible we can still do this. Not a problem. We just gotta need to be more careful. Okay, Clover, please ask your question.
Yes, Dr. Lopez. I just want to say thank you for the classmate that admit that she's taken the course, the
Yeah.
exam once before. That's bravery right there. So, you know,
Yes.
I I I do take my hat off to her. And secondly, for me, you know, I have anxiety, and that's why I have been lingering. Now, I know you can stay too long, but when you think about it, that you might just rush through it thinking you know what you know when you get there, and all of a sudden test anxiety sits in. You have no other choice but to go through it, otherwise you fail. So I
Yeah.
think it's a good strategy. Yes, take your time. Sometimes it gets a little cloudy for me. I think I know it and I'm studying and it goes back and forth, but you know, I I I just want to just put it out there. Like I see Kimberly and I see other people that's been in the class with me, and I'm kind of saying, okay, trying to push myself along, but I don't want to fall in
Yeah.
the trap of rushing through it and
Right.
not
Yeah.
being successful and have to repeat the process.
Yeah. I think I'm gonna do this worksheet. It's gonna take a little while, and then if you can complete the worksheet by memory, you have nothing to worry about. It will
Okay.
be a revalidation of what you already know because I'm going to ask every single question. They might ask you 20 questions of each small training. If you can answer those questions, you'll be like, I already know this. This is easy. So that's it's a surefire way to say, okay, I don't only count on my notes, but I'm going to count on this worksheet that I'm creating right now. That's going to be helpful.
That would be
Okay.
fantastic. That would be fantastic. I
Yeah,
appreciate that.
Thank you, Dr. Lopez.
absolutely.
Yes.
Thank you.
And thanks for
My
your
pleasure.
patience,
Yeah.
doctor, because I have seen other courses that you go for review, and you have been so generous with your time and just sharing your information. Other classes, I see people here that I don't see in the review on
Hmm.
Fridays, and I know they hop from place to place. And other
Yep.
places you cannot get on unless you display have your cameras on and your full name
Have your name.
and your
Yeah.
name and no
Yeah.
organization, and it has to be your name and nobody else's. And I just want
Yep.
to say thank you because I do
Well,
appreciate your giving.
yeah, no, I think I don't like to say this because it might seem a little bit untruthful, but I mean, there is the goal that I sure would love to make it next year and still be here. But also, there is this goal that to me is actually a better goal. I'm coming towards my retirement. I don't. It's not that I say, well, I'm coming towards my retirement and I enjoy what I do. So I sometimes people want to think I just don't necessarily care for the money. I want to see people succeed. And sure, I would love to stay in business and still do what I do because I absolutely love it. And having employees, it hurts me when it comes July and I have to pay out of pocket, which I do sometimes, right? It hurts me. It was like, man, what happened? I really need to pay my employees. But at the end of the day, what do I really care? I care what makes me happy. And seeing you guys pass it makes me super, super happy. And it wakes me up. Like I'm watching these reviews the past 2 days that I started to put my name out there, and I just couldn't sleep. I was so happy to see Seashell and other folks that took the time to do the review. That I said, you know what, I got to do a little bit more. I'm just gonna take the next 2 weeks, and I'm going to do only this. I'm gonna do this micro learning strategy so it can help you guys because it really, at the end of the day, we are here only for a short period of time on Earth, right? We came with nothing and we live with nothing.
Well,
Anything
thank you.
else in between, it's not that your watch is a $300 watch. It clocks the same as a $10 watch. I mean, to me, it doesn't really move the tick. Money wise, sure, I would need a house. I need to pay rent and things like that. But at the end of the day, it's not what makes me happy. So I do what makes me happy. I try when I'm not obligated by my employee to do things that I have to. Most of the time, I do things that make me happy. So I count with honesty and people not sharing passwords and things. But at the end of the day, I'm not chasing it. I'm not chasing it. If somebody needs it, go ahead and have it. Pass the board. Thank you guys for supporting, though. That's all I can say.
We appreciate
I
it.
should I should be more I should be more business minded and for profit, but it's not my goal. Others are there for profit. They don't care about your time or your results. They will not give you money back. They will not give you action. They don't care less whether you pass or not. This is not necessarily me particularly. So I care a lot. So I hope it shows sometimes. I
Dr.
hope, right?
Lopez, I will tell you
It
this.
does.
Yes.
Thank
I
you.
will tell you this. I personally, I was shocked that you gave your course for 6 months. Honestly,
No,
no
no,
reviewer gives it to you for 6 months. And
no.
had I known you when I was still in the program, I would probably have
Yeah.
signed up way in ahead of time because I said, why didn't we know about him? Why don't we know? Why don't other people tell about you? Because you are organized. Everything there, like I'm seated here just to get support, like Clove. If you have not
Mm-hmm.
uh, uh, tested yet and you have your ATT, please, before you schedule your exam, go to your doctor. Please get that letter that tells you that you have anxiety, that gives you or panic attack or something when you're getting the exam into the exam. I did that for the second time. I mean, the second time, I mean, I learned my lesson because I missed out because I bumbled through questions because I was rushing through to beat the time, not to
Mm-hmm.
understand the questions. So the ANCC is not a joke. It's just like
It is.
you have to know your material. So I'll tell you that if you can get extra time, please get extra time, and they are giving it. So
Oh, thank
why
you.
not?
Yeah.
Thank you for that. I did not know that. Thank you.
Yeah.
Yes,
Absolutely.
ask for it. They will give it to you.
I agree with that 100%. I'm doing the same thing. I'm going to get a letter. I'm getting a letter before I take it.
But you have to do it before you do your
Yeah,
test date, okay? So you have
before
to
you
Absolutely.
really
schedule.
read. Yeah, you have to read the requirements, what's necessary, and then you get that, and then you apply together. If you apply later, I don't think they'll give it to you. But
No, you
read.
Yeah, they don't
register
give it
and
to
then,
you.
yeah, you register, you get the letter, and then you set your test date.
Okay.
Okay.
So the
I,
letter is
and
in.
I have my documentation. Thank you so much. And just the piece of in your class, it's just so organized. And I think somebody else said that, and so peaceful. It's not, the shouting and the chaos. I like the way the class is organized, and I know we're passionate. We come from different backgrounds and different cultures,
Yes.
but it's
That's
just
it.
the comedy, and I understand from your perspective because of what we do and where we work and our jobs.
Yeah.
We have to maintain that calm, but all the chaos just sets me on edge. And, you know, so thank you so much for the calm that you bring. I appreciate it.
That's super helpful to me to know that it's working. Like I said, last year we had 740 students, so that's not a small number. And if you guys do have a time, I put a link in the chat box. If you have 5 minutes to drop a review, that would be super thankful on that, because now I'm trying to show, hey, what are you guys are saying? Or is it valid, not valid? Is it good, not good? So I can better understand the service that we provide. So whether it's positive or negative, it really doesn't matter. Having a review so I can better understand. I'm collecting more data to see, hey, what's working, what's not working, how can we make it better? So the first thing we're gonna do is do the worksheet. So that's coming up in the next few weeks. I'm gonna take the good time to work through that so it can help even more. But there was a great interaction today, great interaction on the Kahoot. Yesterday, we spent about 4 hours. Just to reiterate, you can attend as many classes as you want for the class itself. And if you were in the course, there is no restriction. There's no, I'm not going to charge for a question bank. I'm not going to charge for a diagnostic test. I'm not going to charge you for LMR. I'm not going to charge you for 1 through 5 review. It's all together. And as many times as you will like, as many times it takes for you to pass, right? So you guys know this. This is not necessarily a per or per say like uh per mini courses, and I'm gonna charge you $800 at the end of you know, there is nothing like that. So thank you guys for being the course. I'll see you guys next time. You have the schedule. Have any question, write me an email is the best way for me to answer at PMHNP at npexamcoach.com. I'm heading to church at this moment. My wife is at the door waiting for me. See you guys the next time that we have it. I think next week is a holiday, but if it's not,
Dr. Lopez, before you go, I'm
yeah,
sorry. Someone just said they want to take your course, so maybe you want to
yeah,
answer
yeah.
that
Let me. Oh,
in the
thank
chat.
you.
So I don't want you
Yeah,
to miss that. But
I appreciate
enjoy
it.
your worship, and I have a
Yeah,
good night, everybody. Enjoy the rest of your weekend.
Thank you,
yeah.
Clover.
Bye,
Good night,
everyone.
Dr. Lopez. Thank
Good night.
you.
So the psychopharmacology course, I'm going to give you a 50% off if you are listening today right now. Use the code take 50. So, you know, like I said, you know, like nobody would do this if they're for profit, right? Somebody would said, hey, I want to take your course. Why would I give 50% off? Because at the end of the day, it doesn't really matter a whole lot. I mean, it matters that you help us sustain and stay in business. But here's a code, take 50, get 50% off. I'll make sure this code is working for you. And here we go. Have a wonderful, beautiful life. Enjoy what you do. At the end of the day, if you really love what you do, you're not working. You know, it's beautiful that I can set my hours, say, hey, how many patients I want to see. If I want to work at the weekends, I can. If I don't, I don't. That is the life. And that's what we're prepping you for. You know, I know right now we're discussing the board. The board is important, but the beautiful life is what's coming next for you guys. All right. And then just like that, we'll be here forever. As long as I can afford to be around, then 5 years, 10 years, you got a question, we'll be here. And your colleagues next to you that we're making this community will be here. And this will pay off not 10 times, not 100 times, not 1,000 times. You know, some of your colleagues today, 10 years later, you can reach out to you. Hey, Kimberly, you know what? How do you do this? And even myself, hey, Dr. Lopes, I'm in trouble here. Can you help me? Sure. And you will never hear from me a charge. Never, ever. So that's it. Great night, you guys. Love you all. Thank
Thank
for
you.
what you guys do. See you next week. Or next week we have a class. We have a
Thank
schedule,
you,
right?
Doctor. God bless.
No,
Thank
not
you.
next week. I don't think next week is a
Yeah.
holiday.
Next week
The
is a
following.
holiday.
Yeah.
The following week. Okay.
Yes.
See you all.
Well,
Bye bye.
Okay.
Thank
Good
you.
night.
Good
Bye-bye.
night.
Good night.
Thank you.
Dr. Lopez, I'm free to join whenever I want to, right?
Uh, anytime, whatever you want is always free from you. You already passed the board, so you are in for free lifetime things. Okay. Talk to you later. All right. Take care. Bye bye.